Welcome back. It's 8:23. Misplacing your keys, forgetting a doctor's appointment, trouble recalling your neighbor's name. Chalk it up to being busy, overloaded, typical aging, or something more. Joining us this morning, Dr. Jonathan Graf Radford, a neurologist with the Mayo Clinic. He's also the co-editor of the updated second edition of Mayo Clinic and Alzheimer's Disease and Other Dementias book I'm holding in my hand. Sir, good morning to you. I know there's a little bit of delay here on our satellite, so I'm going to wish you a good day today, but also get right to this new blood test that's being studied that might diagnose whether people with cognitive issues actually have Alzheimer's or something else. What do you want people to know about this blood test and where it kind of stands in your opinion?
Thanks for asking that. There is an exciting breakthrough that came out this summer. As you mentioned, researchers reported a blood test that can predict people's Alzheimer's risk. And it will be used similar to how a cholesterol test is used to predict heart disease risk. So initially it'll be used to screen people for clinical trials, but once it's validated, it will be in the clinic used diagnostically to tell if someone's cognitive issues are indeed due to Alzheimer's disease. So it's an exciting time in the field.
I would like for you to answer two questions in this one. Do you have any idea when that will be available to everybody? Because we know that early diagnosis is key. Scientists understanding that changes in the brain may begin a decade or more before they actually start having some of those memory losses. What do you want us to know?
You're absolutely right. Over the last few years, scientists have recognized that the proteins that are toxic to our brain start depositing 2 decades before the first symptoms begin. So having an early accurate blood test like this is a real breakthrough in the field. In terms of when it'll be available, we're optimistic that over the next couple of years, after a few more validation studies, this could be in the clinic as soon as that.
We only have about a minute left, and I want to make sure that we get to this part. I have a grandfather who's in assisted living. He has dementia. It's hard right now, very hard for family members who can't see their family members. We know that connection also helps them. What is important for all of us to realize with our loved ones who might have Alzheimer's or different dementia?
This pandemic has really affected all of us, but in the clinic day in and day out, I hear from my patients living with dementia and their care partners that it's affected them significantly because depending on the level of severity of dementia, they may not understand things like masking and social distancing. Mm-hmm. So it's important you remember you're doing these things to protect your loved ones. But as you mentioned, contact is important, and even if we can't do physical contact with our loved ones, doing things like video visits, frequent telephone calls, or if they're not comfortable with technology, even things like writing letters are very important.
Doctor, we sure do appreciate it. Again, the book, Mayo Clinic on Alzheimer's Disease, he's one of the authors right here. We sure do appreciate it.